Hi, I'm Dr. Steve Brammeier, and this is my friend Skylar. Today I'm going to talk to you a little bit about what's known as kennel cough. The formal name for that is tracheobronchitis. And it's a common problem for dogs, especially dogs that go into kennel situations. Dogs that are housed under one roof with the internal air conditioning system. The dogs are probably fairly stressed in that situation, even though the kennels do what they can to try to make those situations less stressful. They've still been taken out of their home environment and put in a different situation. So tracheobronchitis, dogs cough heavily, they honk, they sound like they've got something caught in their throat, they hack, they gag, they spit up a little white foam, and then they go on about their business. It tends to be worse at night, and it runs a course of about 7 to 10 days. It's very contagious, and one coughing dog can make other coughing dogs, just down the way a little bit. It's generally not a serious disease and primarily caused by a virus, the parainfluenza virus, although there can be a secondary component to it, the Bordetella bacteria. So the vaccine that's used is generally a combination of parainfluenza, which comes in your distemper, hepatitis, parvovirus, parainfluenza combination, and then an extra Bordetella vaccine. The vaccines are helpful in reducing the incidence of kennel cough, but they don't eliminate it entirely. And so your dog still might end up with kennel cough. As a rule, I just recommend the Bordetella vaccine for dogs that are going to be in high stressful situations under one roof kennel. Just regular dog life out at the dog park, playing with your neighbor's dogs, doing different things like that. A Bordetella vaccine generally isn't necessary. And if they do start coughing, they're feeling well, they're not running a fever, it's a virus. And sometimes we will give drugs to help suppress the cough a little bit at night so the dog and the owners can sleep. But generally it's better for the dog to cough and keep that moving around and keep coughing that material up. Once in a great while, just like with people who have a virus, you get a secondary bacterial infection. And then the dogs become more ill. Droopy, don't eat, maybe a thick mucousy discharge from their nose, and you can tell something more is wrong and they probably would need some antibiotics. But that's the exception to the rule. Sounds nasty. Everybody thinks their dog's got something caught in their throat. Oh my God, they've got something caught in their throat. And they come in and it's kennel cough. You still should have it checked out, or at least give your veterinarian a call and chat about what's going on, because you can't really diagnose anything just by listening to a dog cough. That's all for today.